I was from a refugee camp in Thailand. My parents fled the Myanmar country. My name is Maria Che. I am a community health worker and program manager here at MCHH. So I speak Karenni, that is my native language, and then my second language is Burmese. And I'm learning Karen.
My name is Nakle Tu, and I'm a community health worker here at Consortium. I was born in Thailand refugee camp, and I came to the United States when I was 9 years old. The language I speak is Karen, but in translated services there is two Karen, so then to be specific, I speak Sok Karen.
Milwaukee Consortium for Hmong Health was founded in 2008 to bring the awareness and education on cancer screening and cancer education to the community. The beginning, it was like a Chinese doctor that outreach to them because they see like it was a mortality rates are very high in the last name similar to Chinese, right? And then that's how they got outreach to the community, and then they found out that it was from the Hmong community that have a high morbidity and mortality rate from the cervical cancer. And we start with a focus group on that topic, and that we bring in more community. From there, like we start the organization to bring in more awareness of that cancer screening. We are serving the population from Southeast Asian immigrants and refugees, from Laos, like Laotian and Hmong, and then from Myanmar community like Karen, Karenni, Kachin, Chin, and Rohingya, and some other uninsured and uninsured population in the neighborhood. Prevent Blindness Wisconsin and MCHH connect through the Wisconsin Well Women program, provide the vision screening to our Wisconsin Well Women clients. We do have a different belief and culture, but specifically in Karenni, we do have a different tradition from individual too. So mostly, like we do the ritual, or we do what we need to do in our belief first before we access to healthcare. So, and then we normally do not seek help until we are kind of like very sick.
For the Karen community, when they go to the doctor, they believe that the doctor is in charge of everything, every specialties. They doesn't know the difference between each specialties.
Health insurance, most of my clients have state Medicaid, and a few of them have private insurance through work or by the insurance through marketplace. And we also do have some clients that have uninsured, so no health insurance and all. Many of them do not own car, so or do not drive, so they will not be able to go on their own to the appointments. And some people, because of the language barriers, it will be difficult for them to also take the bus on their own, so they will need somebody to go with them who can speak their language. However, like that person might also have to work, and then we are in a survival mode. They are very new to the country, and then they still need to work to earn the income. Yeah, there are a lot of barriers to get primary care or even vision care, especially vision care, because of the language barrier, transportation, or they don't have child care.
When they go into the doctor office and when they leave, I don't think they understand what was being said, because for the health literacy, they don't really understand it, and especially for eye, they don't know that there are like different parts of your eyes that plays role.
Some of my clients feel like they do not need the primary care. We are not used to like a regular checkup. We are just like, okay, when I sick, then I will go to the doctor. So regular health check is not a thing for us, for most of us. Many of them are scared of the results that they will get when they get the preventative screening. In the vision health though, many people think that if they wear the glasses all the time, it will make their vision worse.
My people don't go into the doctor's office for a regular checkup or a routine checkup. They believe that if nothing wrong with you, then you go in, then like you wanted it to be sick somehow. So the Southeast Asians community, they don't really think about visions unless they're experiencing it, like having glasses or having a bad eyesight. With the Korean community, some are very excited to go in because they know that when they come back out, they will get glasses and they will be able to see better. But then some, they feel overwhelmed because they are very unfamiliar with the process of the eye exam, like which lens is clear, which is not. In my community, people associate wearing glasses with having a higher education. So then they will say, oh, you're trying to be like, oh, a teacher. Or like, yeah. And when we use the word teacher, it's not just like teacher who teaches, but then they will say teacher for everybody. Those who have high education. Personally, I think you should go and get a routine eye exam, because you never know what's gonna happen. And if you need to wear glasses, then you should, because it will help you see clear.
Until we don't really see the older generation, when we go ask them if they want a free vision screening, some people say that, oh no, I can still see well, but that they do not really pass the screening. According to the older people, only elderly will wear the glasses, and then they had never seen a younger or a children wear glasses where they came from. They might think that only elder need the glasses, not the young people.
And then for the younger generations, they said that, they see other people wear glasses, so they start wearing glasses so that they can fit in or look cool in a way. But then after wearing it for a while, then they feel like their eyesight is getting worse, and then they need new prescriptions, so then they stop wearing it completely.
There is some confusion because we are pretty new to the country, plus most of our ethnic groups speak different dialects. We do not necessarily have all the words for all the health medical terms.
Let them know the difference in specialty in healthcare with vision, dental, and just our overall health.
Especially the vision health, they do not provide interpreters, and then some clinics do not have interpreter services, but some do have, but different dialect. For example, in the Korean community, we have Korean language, but then we have a Western, Eastern, and then also in Hmong, we have green and white Hmong. So if you got the wrong dialect, then the client would not understand the translation. Yeah. Many of my clients, Southeast Asian clients, want to receive their education through video, like visualize or audio, instead of their reading materials. Many of the immigrants and refugees from Myanmar, they had never got to go to school, so many of them are not able to read or write, even our own language.
In Thailand, we don't hear that a lot about being diagnosed with diabetes, but here it's a lot. And many of them, although they get educated at their primary care provider, some will still not follow, or some just doesn't know how. So in the Korean community, diabetes and visions, they don't have a connections. They think that, your eye is a different problem and diabetes is a different problem. So they don't have no connection whatsoever.
One thing is to get the right interpreter when the clients come, and also take time. Some doctors do not take time when they survey their clients who has a different language background, that it would be a challenge for the client to understand what is really going on.
So for the primary care provider, when the doctor said, oh, you need to get your eyes checked, they will think that, oh, the doctor will make appointments for them, and then they will have to come back to the same office locations for an eye exam. But it's not, it's a totally different doctor, totally different clinic. Let them know the difference in specialty in healthcare with vision, dental, and just our overall health.
Kita na lobe just simi si plohe na na mata rushet tuega pe pilumi chwane pa.
Le me dakli pa no ye semula le ne dikle ma ko me dakli tini the blow mono me pala order jale state insurance ru ne mono with a chule ma kwa bam nu ko le a free lo mono atele ne jino ba ba bloody ne le ne me ba do me do ne with a su do o bam nu ko le ne me do ne akama chena le ne kthira share mono ne me lo wa ta ma che ti me ne with a sun ko wa ti lo mono tab le